Kipkorir Langat, that those are enforcement officers, concerning getting of appointment letters, and the petition was committed to the Committee on Labor, Gender, Youth, and Social Welfare. 4, petition by Daniel Murugu concerning failure by the County Executive Department of Sports to honor, recognize, and appreciate world record holder of 5,000 meters and 1,500 meters top Kenya athletic Faith Kipyegon, like it happened in 2015. And the petition was committed to Culture, the Committee on Culture, Sports, and Community Services. Number 5, petition by Mr. Peter Juguna on behalf of the residents of Kinungi concerning encroachment and illegal acquisition of plots number 74875 within Kinungi Township that were originally earmarked for early child development and education, that is ECD, and dumping site by the Catholic Church at Kinungi to the detriment of the residents of Kinungi land, housing to the detriment of the residents of Kinungi. And of course, the Committee on Lands, Housing, and Physical Planning was supposed to respond and present a report to this Honorable House. Petition by Abrus Lesoi on behalf of the people living with disability in Nakuru County, seeking the Assembly's intervention to ensure that the PWD funds are utilized to meet its intended objective and do not revert back to the Treasury at the end of the financial year. The petition was committed to the Committee on Rules and Delegated Procedures. Number 7, petition by Laban Omsudi urging the County Assembly to restrain the County Executive from hiring law firms to represent the county in county cases and using public funds, paying deliberate, erroneous, dismissed county employees. The petition was committed to the Committee on Labor, Gender, Youth, and Social Welfare. Number 8, petition by Parkview, Mwareki, and Baruti communities seeking the indulgence of the County Assembly to urge the county government to allow and license commercial fishing in their region as they await compensation from the government for the adverse effect of rising water levels attributed to climate change. This petition was committed to the Committee on Agriculture, and as such, we are waiting for reports in this Honorable House. Where action has been taken, a report has to be presented. Where action has not been taken, then the concerned committees need to expedite and bring substantive reports in this Honorable House. Honorable members, further to this, the respective committees are reminded to fast-track the consideration of other businesses before them, including statements, in order to enable the plenary to have enough business for deliberation. The pending statements: 1, the Chairperson Committee on Budget and Appropriations to respond to a statement that was requested by the Honorable David Wathiai concerning the distribution of hawkers vouchers under the Youth Empowerment Program in the Office of the Governor. 2, the Chairperson Committee on Finance to respond to a statement that was requested by the Honorable Ali Hassan Abdi concerning the implementation of access to government procurement opportunities, otherwise known as AGPO, by the county government of Nakuru. 3, the chairperson on energy, environment, water, and natural resources to respond to a statement that was requested by the Honorable Alex Langat concerning the effluents that are being discharged into Molo River by Daima Dairy Plant. Petition number 4, the chairperson, Committee on Energy, Environment, Water, and Natural Resources, to respond to a statement requested by the Honorable Robert Ruto concerning water piping project across the Laluet and Mugun in Kapkures Ward. 5, the chairperson, Committee on Agriculture, to respond to a statement requested by the Honorable John Masharia concerning the status of cold store, which is an ARIG project for the financial year 2022-2023 in Turi Ward. Statement number 6, that is pending. The chairperson, Committee on Implementation, to respond to a statement requested by the Honorable Stanley Karanja concerning the implementation status of Karai Fish Market fence in Naivasha East Ward. Petition, this is a pending statement. Number 7, the chairperson, Committee on Land, Housing, and Physical Planning, to respond to a statement requested by the Honorable member for Nakuru East, the Honorable Anthony Kanyere, concerning construction of affordable houses at selected county estates. Number 8, the chairperson from the Committee on Trade, Tourism, Cooperatives, and Planning, to respond to a statement that was requested by the Honorable Grace Mwadhi on the number of licensed bars in Bahati Ward. Number 9, the chairperson, Committee on Land, Housing, and Physical Planning, to respond to a statement that was requested by the Honorable Wadhiai Masharia concerning the ownership and rent remittance of Molo County houses. Number 10, the chairperson of Committee on Lands, Transport, and Public Works, to respond to a statement requested by the Honorable John Mwangi concerning status of Imarisha Barabara program in Turi Ward for the financial year 2023-2024. Number 11, the chairperson of the Committee on Finance, Economic Planning, and Administration, to respond to a statement that was requested by the Honorable Philip Wanjoy concerning ward project savings. Number 12, the chairperson of the Committee on Roads, Transport, and Public Works, to respond to a statement requested by the Honorable Moses Kilel concerning the status of county roads in Kuresoi North Sub-County, which had been dilapidated as a result of transportation of heavy logs due to tree logging. Number 13, the chairperson, Committee on Agriculture, Livestock, Fisheries, and Cooperatives, to respond to a statement that was requested by the Honorable Moses Koros concerning the potato cooling plant in Kimasai Center, Mauche Ward, Joro Sub-County in Nakuru County. Number 14, the chairperson, Committee on Labor, Gender, Youth, and Social Welfare, to respond to a statement requested by the Honorable Wadhiai Masharia concerning county employees who are either on interdiction, suspension, or dismissal from the public service. Number 15, the chairperson, Committee on Labor, Gender, Youth, and Social Welfare, to respond to a statement requested by the Honorable William Mutai concerning the status of the recruitment of the recently advertised jobs by the County Public Service Board in various departments. Honorable members, I also wish to inform you that the committee sittings are fully resumed. The schedule for committee sittings have already been circulated by the office of the clerk. As I conclude, I wish to remind you that the rules and procedures plays a crucial role in conducting the business at both committees and plenary levels to enable members have an informed debate and contributions before the House. I wish to urge everyone to develop the consistent practice of continuous interaction with the standing orders and other laws which govern the business in the House. I take this opportunity once again to welcome you for the second part of the third session and wish you a fruitful session. Thank you, and we wish and hope that we're going to have a very productive session. Thank you. Next order.
Order number 3, messages.
There are no messages. Next order.
Order number 4, petitions.
No petitions. Next order.
Order number 5, papers.
There are no papers to be laid. Next order.
Order number 6, notices of motion.
Next order.
Order number 7, statements.
There are no statements. Next order.
Order number 8, there's a motion.
There is a motion by the Honorable Peter Juguna Maura, the Chairperson, Committee on Health Services.
Thank you, Mr. Speaker. Mr. Speaker, I rise to move a motion on benchmarking reports at Kenyatta University Teaching, Research and Referral Hospital, held on 30th September to 3rd October 2023 by the Health Committee. Mr. Speaker, the main aim, or rather the objective of the benchmarking visit was to ascertain the quality of services offered to the members of the public by the said facility. We also wanted to evaluate the state of the art equipment that the facility has, the achievement of the hospital has of the hospital over the years, the challenges and areas of improvements as far as service delivery is concerned. Mr. Speaker, those were among the issues that made us actually to visit that facility, so that we can also compare that facility with our PGH here, that we can claim is also our art of equipment facility, or the best of the best facility, if not in the country, but in this region of Central Rift. Mr. Speaker, the Kenyatta University Teaching, Referral and Research Hospital is a Reading Public National Hospital, which is a level 6, with 650 bed capacity, equipped with the state-of-the-art medical equipment. The hospital employs cutting-edge research, innovation, training, and partnership to keep abreast with advancements in health care management. This enables it to address the current health challenges and ensure that they are responsive to emerging and future health challenges. The hospital offers a quality patient-centered care where the patient is an active participant in their care. This brings about improved patient health outcomes and satisfaction and improved job satisfaction among the healthcare providers. It is worth noting that specialized care is one of the flagship services that the hospital has heavily invested in, where patients are attended to by highly specialized consultants. The vision of the hospital: a premier referral hospital renowned for excellence in clinical care, training, research, and innovation. The mission of the hospital: to enhance the health and well-being of Kenyans and global citizens through provisions of patient-centered and evidence-based healthcare. The hospital operates under the following core values: integrity, and that is key, because last week I heard that there was finance committee that went to PGH, and therefore I want to put a lot of emphasis there, because integrity is of essence, and it's a key ingredient in the learning of each and every facility. Teamwork, compassion, accountability, equity, and diversity. Those are the core values for that facility. Mr. Speaker, you can see even from the photograph, that is actually the artillery view of that facility. And that facility is one of its own kind. And I would say in sub-Saharan Africa, I think we just have 2 facilities of such kind. So it's one of the best facility. And even before I go to the details of the facilities outlined by this report, how I wish that the members will find time, as a whole house, we go there and see the kind of the facility that we have, Mr. Speaker. Mr. Speaker, interactive session with the Kenyatta University Teaching, Referral and Research Hospital Management. The hospital is divided into 8 departments that work hand in hand for effective and efficient service delivery. Directorate of Administration and Corporate Services. The Directorate of Administration and Corporate Services offers technical and professional guidance to administrative functions of the hospital. It is responsible for providing leadership, oversight, and direction for the smooth, effective, and efficient operation of department and hospital at large. The directors offer supports to the facility so that they can continue actually offering the best services for that facility. Moreover, the department develops and fosters effective collaboration between various departments, staff leaderships, and other affiliated services to ensure an integrated approach to providing services and fulfilling the hospital visions, missions, and mandates. Other responsibility of the directorate is to oversee hospital physical facilities and be responsible for the maintenance of facilities and equipment. To set the organization's culture, Mr. Speaker, to put emphasis onto this, what we are lacking as a country and as a county currently is the lack of setting culture or a culture of individuals at workplace. Whereby you realize here in this county, if you go to many of the facilities, the only culture they have been socialized to is a culture of making money, nothing else. And that's what actually has been pushing many of the staffs that we have, rather than another culture of service delivery and culture of self-satisfaction because of the job that you are trained to do and the service that you deliver and you offer to your country. In essence, Mr. Speaker, I'm saying what we are lacking in majority of our facilities here is the lack of that of patriotism, where individuals have self-drive as far as the service delivery is concerned. But this facility has set a department that majorly deals with the issues in this administration and the corporate services, where they deal with the issues of molding and mentoring their staffs so that they can be able to have self-drive, and also they can offer the best of the best services to the patients and to the citizens of this country. They also oversee the creation of referral networks to ensure effective and smooth patient care and operations. They foster strong partnership and networks to facilitate the development of comprehensive healthcare systems, ensure that hospital is accredited nationally and internationally. As I said, Mr. Speaker, this is a referral hospital for the central and to some extent South African. This is a regional facility in terms of the globe, because this, Mr. Speaker, the kind of the things that we saw there, in fact, we never believed that we are in Africa. We believed maybe we are in another first world country, because this facility is one of the advanced facility That's why they ensure that they are accredited even nationally as well as the issues to do with the research and also service delivery. Ensure that the hospital is, represent the hospital in professional forums and compliance with the regulatory and statutory bodies like WHO. Directorate of Finance, and this is why I want also to emphasize because of the issues at our facilities as well as the finance handling is concerned. The Directorate of Finance ensures prudent management of financial resources by implementing accounting policies, systems and procedures, and reporting on the financial performance of the hospital. Some of its core functions include participation in the budgeting process for the hospital through the health sector, ensuring strict adherence and implementation of the approved budgets, ensuring optimal collection and utilization of financial resources, ensuring compliance with the statutory requirements, financial reporting to management and regulatory bodies, among other responsibilities. Mr. Speaker, those are the guiding points and how I wish all our facilities can borrow a leave from this department, and how I wish even the executive are going to take their people to that facility for benchmarking so that they can learn a lot about how those people manage their affairs as far as finances are concerned. Directorate of Clinical Services. The Directorate of Clinical Services is an instrumental department in the hospital that delivers medical, surgical, pharmaceutical, diagnostics, public health, and quality assurance services. It further monitors the clinical performance throughout the hospital and promotes the culture of excellence in patient safety, clinical research, training services, quality of care, and patient experience. Moreover, the Directorate ensures that the patients have access to adequate and appropriate medical staff. That is key, Mr. Speaker. And I want to highlight it because if you go to our facility today, number one, we are very understaffed. Even the kind of the staff to some extent, if you look at the staff to patient ratio, it is compromised. It does not adhere to the standard of the WHO, and even the number of the kind of the patients that are actually seeing our patients, to some extent, before even you meet a consultant, it takes a while. Or it's something that already I don't think that it's actually being experienced by our patients in our county. And therefore, this is where we really wish that the county focus on so that we can be able actually to have proper services being rendered to our patients, and including ourselves, Mr. Speaker, because we are also consumers of the services that are offered by our facilities. With the facilities core agenda being the delivery of timely and quality clinical services, this department is tasked with the responsibility of medical governance oversight. The facility also leads and guides the development, approval, and implementation of specific best clinical practices and patient care-related policies and procedures. Additionally, the Directorate ensures that there is a cohesion between all stakeholders in clinical referral, clinical research, and training in the process of care delivery. Directorate of Nursing, Mr. Speaker, because of time, allow me to skip so that also the members can have the time to look into that at their free time, so that at least they can also abreast on themselves on these issues of the Directorate of Nursing services that they have. Directorate of Integrated Molecular Imaging Center. The Directorate of Integrated Molecular Imaging Center offers both the diagnostic and therapeutic services in the management of cancer and other diseases. It is a modern and the first ever public IMIC, not only in Kenya but also in the region. And I said in the sub-Saharan Africa. This is one of its own kind. In fact, we are competing with, I think, only South Africa, Mr. Speaker, at that time when we visited the facility. It's only South Africa. And in fact, they introduced this department when they heard that Kenya, we have such kind of facility that has such kind of department. The goal of the Directorate is not to increase the capacity of the hospital to offer a fully is to increase the capacity of the hospital to offer a free comprehensive continuum of cancer care. This capacity entails prevention, screening, diagnosis, treatment, survivorship, and palliative care. The IMIC Center includes commercial cyclotron, 2 positron emissions, tomography, or PET, computed tomography scan, CTs, that is like the CT scan here, what we usually have here. A single photon emission, computed tomography machine, 256 Rice CT, and 3 Tesla magnetic resonance imaging. Additionally, the center features an accommodation facility that hosts up to 100 patients who are accessing services at the hospital or their members of the family. The directorate will support other cancer centers in the country and the region that invest in PET CTs through the provision of consumables, focus group discussions, general support, personnel, and technical support. The center has the following impact on Kenya and regional citizens, that is, patients from other countries. Early diagnosis and assessment of response to treatment, accuracy in diagnosis and treatment of cancer, improved survivorship, reduction in waiting time, significantly reducing cancer-related mortality, reverse outbound medical tourism, attract medical tourism from East, West, and Central Africa. Mr. Speaker, we've been talking that we have a department here that deals with the tourism, but as a country, if we can equip our facility to that level, I can assure you, Mr. Speaker, that we're also going to attract people coming to this country, number one, to seek medical attention, and also to come and see whatever facility and equipment that we have. Mr. Speaker, it has been known that all our patients have been going to India to seek medical attention. But now things are turning, Mr. Speaker, and we can take advantage of this where other African countries can be coming to Nakuru to seek medical attention and also to understand and to learn more about that facility and equipment that we have, and also our cultures, therefore adding revenue to this country. Therefore, I would wish that this report will be taken seriously and different departments can consolidate their consortium, or rather they can have a consortium sort of thing, so that they can focus towards equipping this facility and so that we can be able to advance, Mr. Speaker, as far as the equipping that facility is concerned. Mr. Speaker, gone are the days that when people used to come to see animals in this country. In fact, the number of tourists have significantly reduced because of the issues of networking, the issues of technology where they are viewing animals at the comfort of their houses. But with this art of equipment, tourists can come to this country. Mr. Speaker, therefore, I would wish, and now I wish even these members, Mr. Speaker, can go to that facility and see whatever is happening. Mr. Speaker, another directorate that I would wish to emphasize on is the Directorate of Human Resource Development, because that is another thorny issue in this county as far as the medical department is concerned. The Directorate of Human Resource Development is responsible for creating strategic, operational, and administrative procedures to support employees to ensure optimum performance in the provision of highly quality patient-centered healthcare services. The Directorate focuses on recruiting, developing, and retraining top talent, and is responsible for formulating, implementing, and evaluating HR policies and strategies to support the hospital in achieving its objective. The Directorate plays a key role in shaping the DNA of the hospital by ensuring that the staffs are inducted into the KUTLRH culture and strong instilling the core values of the hospital within the workplace. The function of the Directorate include human resource planning, recruitment and selections, onboarding, talent management, performance management, compensations, staff development, employee relations, and employee welfare, among others. The people-centric directorate subscribes to strong ethicals and principles which include integrity, professionalism, fairness, and objective excellence and best practice. Mr. Speaker, if you can at least visit there and see the kind of the persons who are offering services there, you'll be mesmerized. And I want to tell this House that people there are employed on contract. And they emphasized that the way to go, if you want to learn your health facilities, is contract way. Mr. Speaker, I want to put more emphasis there, and I want to repeat. They told us the way to go, if you want to manage your health services, is contract way. But make sure you offer the best remuneration to the contracted staffs. And they are paid on basis of performance. The number of patients that you attended to, so it's upon you. The number of patients that you attended to, satisfactorily, that's when you are paid. It's not an issue whereby you say that if I wish to go to the facility, I will go. If I feel I will sleep, you sleep. Mr. Speaker, they are paid on the number of patients that someone attended to. Therefore, it's one of its own kind. And I can tell you, if we can be able at least to copy-paste some of the HR policies that they have, I tell you, our PGH, our facilities are going to improve, and even the doctors here are going to work towards making sure that they have offered services in a satisfactory manner. Because, Mr. Speaker, what we have realized here, we have consultants who never go to work. They go into their private clinics. We have nurses who don't go to work. They go to the private clinics. And the rest of human resource in this county, Mr. Speaker, that is the same thing that actually we are experiencing. Mr. Speaker, I usually say, if members here were employed on permanent basis, you'll never find someone here. They'll never even attend to Anjiko. So, Mr. Speaker, contract is the way to go, and I'll be one of the advocates and ambassadors of saying that we need to synchronize our human resource so that we go to that level, Mr. Speaker, so that people can be able to enjoy services. Mr. Speaker, allow me to request the members to look and to see that, actually to follow up on these issues, so that I can go to the other areas that I believe there are also areas that we need to look. Service offered at this facility, they have an oncology center that has surgery, chemotherapy, and radiotherapy. And, Mr. Speaker, their surgery, they have cyber knife, Mr. Speaker. And that cyber knife, Mr. Speaker, is one of its own kind that you operated, seated comfortably somewhere by somebody who is actually operating a computer. And, Mr. Speaker, if only the members can agree to go there, Mr. Speaker. Because we wondered, when we went to there, Mr. Speaker, we wondered whether we're in a hotel, not even a 5-star hotel, I can call it 6-star hotel. Because there is even a presidential suite, where even the president, if we want to come there, to go there and relax to be attended to for a month, it's a hotel, Mr. Speaker. So therefore, Mr. Speaker, how I wish that one of the whole house, Mr. Speaker, you'll dedicate it to members to go there and see for themselves, because seeing is believing, and I believe when people can see things, they are going actually to improve. Mr. Speaker, on the issues of the cancers have already been outrighted, actually been encapped in this report. Members can go through. They have also pediatric unit that has different departments. Members can see in that report. They also have other departments, Mr. Speaker, like ambulance services. And they also have a neonatal intensive care unit, one of its own kind, because there are no other places with such kind of facility. Members can also see in that area. They have ICU and HDU. I don't want to go into details because, Mr. Speaker, the report is actually, it's simple. And members can be able actually to understand it in a simple manner. They have also accident and emergencies department that deal with those issues of emergencies. And that department, Mr. Speaker, is highly equipped. They have renal unit services. And in this department, Mr. Speaker, they have 20 renal dialysis units that operate 24 hours. Ours here, Mr. Speaker, operate in 12 hours, but they just operate in 24 hours. And, Mr. Speaker, these issues of renal services is another department that we really need to critically analyze and look at, because I can tell you, Mr. Speaker, if there is something that is bothering our population, Mr. Speaker, is these issues of renal services. And we have like 4 machines here, Mr. Speaker. And they are under placements, and the majority of them are not working, Mr. Speaker, because of the various issues of the contracts between those who are actually offering the placement services and the facility, Mr. Speaker. Therefore, we really need to look at this issue. And I want to say that if only our facility here can invest on the renal services properly, like the one that we saw in that area, I believe, Mr. Speaker, we can also generate a lot of revenue that will be brought back to that facility so that it can be able now to stand on, actually on its foot. Radiology services, those are the services they offer. They also have rehabilitation services, but I said they are highly equipped, Mr. Speaker. Mr. Speaker, they also have surgery services from the pediatric surgical outpatient clinics, maxillofacial surgery. If you want to change your face, Mr. Speaker, they also do that. And if you want to, Mr. Speaker, you know, we had that case of Andrew and Andrea. These are the kind of, they can also be able to do so, Mr. Speaker, but ethically, Mr. Speaker. They have pediatric surgery outpatient clinics, ENT services, obstetrics and gynecologist department, or other services, and so on and so forth. Mr. Speaker, as I highlighted, they have the executive wing, that where the VIPs usually go. And the hospital has Onesmo Ole Moyoi presidential suites. That one I had highlighted, Mr. Speaker. And Mr. Speaker, how I wish even the members can be going there for checkups, for medical checkups. And they say that actually they are habitable. And when you go there, Mr. Speaker, for medical checkups, you don't go for a single day, Mr. Speaker. You must be there for 3 days. You'll be actually be taken care of, even you'll be massaged. That's one of the best facilities that I have ever seen. I've been to Uganda, to Rwanda, to Tanzania, but I've never seen such kind of facility, Mr. Speaker. And I'm putting a lot of emphasis, Mr. Speaker. Let these members go and see for themselves. They also be trained, Mr. Speaker. And they're offering training for free to the members. So members, how I wish, Mr. Speaker, that in the next whole house that we go into Nairobi, dedicate 2 days for these members to go to that facility, Mr. Speaker. I'm not actually marketing that facility, but the art of the equipment that they have and the infrastructure speak for itself. They also have mental health services, the VIP services, and the last, Mr. Speaker, psychiatric disciples employed in our, they also, Mr. Speaker, allow me not actually to go to details because the reports actually speak for itself, and allow me to go to direct to the recommendation, of the observation and recommendation of the committee, because they have all that we need as far as this report is concerned. And because it is a detailed report, Mr. Speaker, I welcome and I invite these members to go through this report, Mr. Speaker, so that they can understand what we ought to have. And they can see the direction that Nakuru County ought to take. And, Mr. Speaker, so that they can be remembered, Mr. Speaker, they participate in the policy making as far as our facilities are concerned, and also as far as the, our PGH is concerned. Mr. Speaker, allow me to go to the major achievements of that facility so that I save time as far as the pharmacy is concerned, because this is where another thorn area in this county is. The facility prides itself in quality patient-centered care. The staff comprising of pharmacists and pharmaceutical technologists are highly trained and dedicated to ensuring good patient outcomes and patient satisfaction. The pharmacy's outlets include main pharmacy. So everywhere you go, you will find a full package. If you are a dermatologist and dermatologist unit, they have even their pharmacy and their labs, everything packaged at that department. They have, this is the central pharmacy that serves both inpatient and patient specialized clinics, theater and wards. Accident and emergency pharmacy operates around the clock, serving inpatient, outpatient and emergency prescriptions. Oncology pharmacy offers specialized care to cancer patients with a dedicated oncology ward. The oncology pharmacy monitors therapies for patients in both inpatient and outpatient. IMC pharmacy is a radiopharmaceutical pharmacy outlet that works in conjunction with oncology pharmacy to offer specialized or optimized cancer care. Specialized clinic pharmacy Being a referral hospital, the facility offers specialized care to patients that need dermatology, ophthalmology, neurology, pediatrics, and cardiology care. As such, there is a dedicated pharmacy outlet to serve patients in the critical and specialized care units. The pharmacy commodities and supplies unit acts as the central store. They are responsible for purchasing, storing, and distributing pharmaceuticals products to various pharmacy departments and are an integral part of the pharmacy supply chain and logistics. Mr. Speaker, I don't want to comment, but I would say, let's go there, let's be witness, and let's make some changes in this county. As I said also, I have returned the issues of the cyberknife treatment, one of its own kind in Africa. So let's go there and let us see what we can be able to do and what are the changes that we can be able to bring to our county. Findings and observations for Kenyatta University Teaching and Referral Hospital. The hospital has high quality state-of-art equipment, as outlined, including the cyberknife and the imaging equipments and so on and so forth. The hospital has a wide range of services offered to patients, thus acting as one-stop shop for patients with multiple illness. The hospital has a well-motivated healthcare workforce, thus offering quality services. The hospital has adequate staff to take care of the patients. The hospital has the best infrastructure in East and Central Africa. The hospital has modern cancer center that is fully equipped with needed equipment and staff. Those are among the many observations that we made. And Mr. Speaker, how I wish that at least, including you, Mr. Speaker, you are going to actually to accompany us to that facility. We be trained. They requested us actually to go, all of us, so that we can also be trained what they mean when they say they mean business. Recommendation that the county government of Nakuru Department of Health Services, in collaboration with the management of Nakuru Provincial General Hospital, should visit Kenyatta University Teaching, Referral and Research Hospital to learn more on the services offered and the state-of-art equipment in the facility in order to upgrade the upcoming facility in the county. That the county government of Nakuru should allocate more resources to recruit staffs to meet the existing needs of the patients in the county. Mr. Speaker, if this one's recommendations can be actualized, we are going to be on a safe hand. Mr. Speaker, I want to also to add another one, that we need to make PGH a parastatal of this county, so that it can be able, Mr. Speaker, to operate independently and to offer quality services to the members of the public in this county. Mr. Speaker, I want to repeat because I know there are a lot of handles and hindrance towards that. We need to make our PGH a parastatal so that it can be able to compete regionally and also countrywide, in the country, and also in the region of this of sub-Saharan Africa, because we believe we have the potential and we can be able to walk on our foot. That facility, or this facility of ours, PGH, has stamina, and I believe it is capable and it can be able actually to deliver its mandate to the people. Mr. Speaker, I wish to end there and request Honorable Morogo to also say something, Mr. Speaker, as a way of seconding this motion, and also requesting the members to take their time, Mr. Speaker, to read this report, because I would have read this report the whole day, but how I wish, Mr. Speaker, members are going to internalize themselves with this report, so that when we be going for trainings there, because they'll be offered, Mr. Speaker, you don't need to take ourselves there. I believe things are going to change. Our perception towards health, our perception towards our facilities are going to improve, and members are going actually to do the proper service of oversight, and the members of the public are going to enjoy. Mr. Speaker, I wish to end there. Thank you, Mr. Speaker.
Thank you, Mr. Speaker, sir. Honorable Speaker, I want to concur with the chair, and I will begin by thanking the committee for their time and their dedication visiting the KU, na niseme kwamba ni wakati wetu kama kaunti ya Nakuru tuweze kupata nafasi ya kujifunza, kwa sababu ni hospitali ya kifahari kama vile tumeambiwa, na tuna mengi ya kujifunza kama kaunti, na ninaomba kwamba chair yetu amesema mengi, na kama nyumba ama kama assembly yetu ya Nakuru tunaomba kuweza kupata nafasi ya kutembea kule na kupata mengi ambaye tutayaiga na kuja kutekeleza katika kaunti yetu ya Nakuru. Asante Bwana Speaker.
You didn't say whether you've seconded or...
Mr. Speaker, I second.
Thank you. The motion is that this House adopts the report on the health services on the visit to Kenyatta National Hospital held on 30th to 3rd October 2023, which was laid on the table of the House on Tuesday 16th April 2024. The motion is open for debate. The Honourable Member for Menengai East.
Thank you very much, Mr. Speaker, for the opportunity, and recommend the team that went to KU and furnished us with a very good report. And Mr. Speaker, I was among the team that was at KU, and I managed to visit the whole of the hospital, or the different departments in the hospital. And Mr. Speaker, this is a hospital that is really well managed, with good facilities. In terms of drugs, Mr. Speaker, it is well equipped. In terms of personnel, Mr. Speaker, this hospital has good personnel, Mr. Speaker. The objective, Mr. Speaker, of visiting this referral hospital is to make sure that we check, or we recheck on how we are moving with our own provincial general hospital, which is also a referral and level 5. And Mr. Speaker, we have a very big difference in terms of the services given to KU, Mr. Speaker. I wish, Mr. Speaker, that we, as a member of this House, make sure that our PGH is well managed. But the problem with our referral hospital, Mr. Speaker, is that it has been having a lot of intrusion of so many politics. And the executive team have not been managing this hospital in the right way, Mr. Speaker. In terms of personnel, you find that when you go to PGH, some of the doctors that had been placed in so many departments are not there, Mr. Speaker. Most of them, they're in their private hospitals. Some of them, they are running even chemists just near the hospital, Mr. Speaker. And that is why you have heard from our chair saying that most of the doctors are on contract. Mr. Speaker, this is the right time as this House to make sure that the doctors that we are having in our provincial hospital are on contract, Mr. Speaker, so that they can give the citizens of this county the right services. Mr. Speaker, when you go to PGH, because the objective was to recheck whether we are moving on the right way. And Mr. Speaker, you find that most of the equipment that are in this hospital, they are not modern. They are old age, Mr. Speaker. And that's why there are so many breakages. Every time you find that the machine is not working. And Mr. Speaker, when you visit the private clinics, they have those machines, Mr. Speaker, who are running them. They are our doctors, of which we are paying with our own revenue, Mr. Speaker. So we are not going to stop the private doctors or our doctors running their private hospitals. But, Mr. Speaker, can we be paying them under contract so that they can manage our hospitals? They can take most of the time in our PGH hospital. Mr. Speaker, this is only our referral hospital that we have in this region. And it's getting a lot of patients from different counties. And we need this hospital to be managed well. We are collecting revenue. And also, Mr. Speaker, we are also finding that most of the revenue that is collected in this hospital is almost going to somebody's hand, somebody's pocket, Mr. Speaker. And there was a team that visited that hospital the other day. And they have a clear report, and I know they will table that report in this House. Mr. Speaker, this is the right time. We need to change this hospital. We need to change the management of this hospital to make sure that we get the right services. Because the only problem that we have is with the management. Thank you, Mr. Speaker.
Thank you. The Honourable Member for London, who happens, that's where the hospital sits, our equivalent of the same. And then the Honourable Member for Kerrigat, and later the Honourable Member for Nakuru East.
Thank you, Mr. Speaker, sir. Also, I take this opportunity to acknowledge the good work that has been done by the Health Committee. Mr. Speaker, sir, I believe for us to be able to have good services at our referral hospital here in Nakuru County, the PGH, number one thing that we are supposed to do is to try as much as possible to convince the department so that they can be able to do what we call sensitization, civic education or awareness to our people in regard to primary health, promotive health, so that cases that will be going to the referral hospital are emergencies or referral cases, Mr. Speaker, sir. With that self-awareness, Mr. Speaker, sir, our people will be able to go for early screening so that they can be able to realize their health stance, and they will be able to seek treatment at an early stage, Mr. Speaker, sir. Also, Mr. Speaker, going by the report and seeing the infrastructure in the facility that the committee went for benchmark, Mr. Speaker, sir, you can see the impression. And the first impression means a lot, Mr. Speaker, sir. That one will make someone who maybe feels to go treated in such a facility, Mr. Speaker, sir. It is very convincing, Mr. Speaker. It has the services up to standard required, Mr. Speaker, sir. And the equipment that are in that hospital, Mr. Speaker, sir, are of modern and also are of good quality, Mr. Speaker, sir, in a way, convinced by the infrastructure that is there, Mr. Speaker, sir. Mr. Speaker, sir, seeing the renal department that require utmost hygiene, Mr. Speaker, sir, and going by whatever that we have been able to see from the report, I believe those are standards that we are supposed to, so that it can be very inviting for those who seek treatment in such a facility, Mr. Speaker, sir. And going by what the chair held, I have been able to convince us in terms of benchmark. It will invite so many other maybe people or people who are working in health facility in different part of this continent for benchmark in this county. And with that, Mr. Speaker, sir, we'll be able to help our people business-wise. And also, it will be like an exchange program where we can be able to learn the best practice from them as they come to benchmark with us, Mr. Speaker, sir. Mr. Speaker, sir, I believe we are heading whereby we'll be able to be contracting health officers or doctors who are working in health facility and so many other institutions, so that you are paid in regard to whatever that you have been able to work. Because at the end of the day, even for us, the job that we occupy, Mr. Speaker, sir, we have to give the scorecard at the end of the elected time that you are supposed to serve in this assembly, Mr. Speaker, sir. I believe that is what we are yet to go as a country, so that each and every person can be able to give whatever that they have been able to fruitfully done in terms of ensuring that whatever that they were employed for, they are able to. Mr. Speaker, sir, I believe it is our responsibility as an assembly, especially the health committee, to ensure the money that are collected within the hospital are reused in the same facility to improve as FIF, so that we can be able to have quality services that are required. In terms of personnel, I believe in that line, in regards to our PGH, I believe we have not enough personnel, but we can look in a way on how maybe we can have enough personnel and modern equipment so that we can be able to offer health to the standard required. Thank you, Mr. Speaker, sir. I support the report.
Thank you very much, Mr. Speaker, for this opportunity. I also stand to support this report of the State of Art Hospital, Kenyatta University Teaching and Referral Hospital. On the onset, Mr. Speaker, sir, I want to say that this is a very wonderful report that is going to provide a benchmark to our facilities in the county. Mr. Speaker, sir, I want to draw my comments on 3 areas. Area number 1 is the Directorate of Human Resource Development. And as the chair was going through the reports, I got a lot of keen interest on this area because I really wanted to know the kind of management that the Kenyatta University Training and Referral Hospital is undertaking as far as the management of human resources is concerned. And Mr. Speaker, sir, I got really motivated by some wordings here that says that the department is people-centric. This one inspired me even more when they talk about the ethical values and the principles that are guiding the human resource in the department, which actually include the integrity and professionalism, which they were able to assess, and they were able to see that indeed these are the values that are actually embraced in the department. This is quite encouraging, bearing in mind that it's hardly some 3 weeks ago when we got a report from one of the health centers in our county, that's Naswet Hospital, that was also given by the chair. And Mr. Speaker, sir, when in a small way and in a big way, when you compare these facilities, which actually replicates a lot to the standards that we have in the health facilities in our county and also in this referral hospital, it really tells a lot that we have to do quite a lot. When for sure you look at that report and you compare with what was given, it gives us a lot of challenge in our county to even do much more to ensure that at least we improve our facilities. Integrity is what is lacking. When there is no integrity, Mr. Speaker, sir, and there is no professionalism, people will just do their work the way they think without a common direction. And I want to believe, Mr. Speaker, sir, taking this one into consideration, though we are not told about how effective they are, but from the report you can sincerely tell that the workers there, the staff there are really working hard and they are doing their work effectively, unlike the facilities that we have. I've just remembered what the chair told us about that they visited one facility and the nurse in charge arrived very late at around 11. This one is an indication that there is a lot of laxity generally in all our health facilities, and something has to be done to that effect. This report indeed is so viable, is a very important one, and it can be used in comparing and contrasting the effectiveness of our workforce in our hospitals. Another issue, Mr. Speaker, is on Directorate of Finance. This is also another very, very important department that has also been pinpointed here, that it is actually concerned with about 5 roles. But I want to draw my attention to role number 3, that is talking about ensuring that there is optimal collection and utilization of financial resources. Mr. Speaker, sir, I think that one in itself has been seen to be a great success in this referral hospital. Unlike in our general hospital, just recently, though we are still waiting for an official report from the Finance Committee, but it's something that cannot be hidden anymore, that there are a lot of lapses, there are a lot of loopholes in the hospital where the finances that are collected don't really get into their destination, the required destinations. There are a lot of leeways, and a lot of resources, therefore, are lost to that effect. So something, therefore, has to be done on that. I'm also drawn to number 4 under the same Directorate of Finance, ensuring that there is compliance with the remittance of the statutory fee that is collected. I happen to have walked into one of the facilities in my ward, and I realized that the payments that are usually made within, the salaries that are made within the hospital to the workers that are on contract, they were complaining very seriously that their statutory collections are never remitted to the required institutions. So something has to be done to that effect. So this is a measure on what is actually taking place. Lastly, Mr. Speaker, sir, I think I must also look at the recommendation that has been given on 6. This is to do with the hospital has well-motivated healthcare workforce. This is a very strong point that should also be borrowed. They are motivated because, one, is that they are well paid, and I believe they are also timely paid, though it's not indicated in the report, but I believe that is actually part of the motivation. Another thing that it could also be motivating them are the facilities that are available. Not forgetting to take into consideration the issue on the well-balanced staff. when you look into our facilities around, I've also been making an attempt to visit most of the facilities that I have in my ward. And the moment you just reach there, you see faces of unmotivated workers and with a lot of complaints. You hear them complain about lack of facilities, and if there are facilities, they are old and dilapidated, not working. So those are the kind of things that the reports that you get. So I think another thing is that you find that the proportion of the qualifications also is not considered, something that we are going to look into one of these fine days. I met one of the staff, and I was complaining very seriously that he has been in the facility for a very long time, but unfortunately, he doesn't see the future because he holds a degree. And in most cases, they take more regards to the diploma holders because they can easily be paid. I got a bit perturbed with this kind of statement, and I felt that something has to be done, Mr. Speaker, sir, to that effect. So very soon, God willing, I'm going to make a statement requesting on the distribution of qualifications in our hospitals to see whether, sincerely speaking, this is true. We want to know whether the degree holders have actually been sidelined because of the same. Otherwise, this report is very prudent, and if we are going to adopt it, it is going to take us to greater heights. Thank you very much, Mr. Speaker.
Thank you. The member for Nakuru East.
Thank you so much, Mr. Speaker, for giving me this chance to give my sentiments towards this report. First and foremost, let me register my appreciation and to say thank you for the good work that has been done by this committee. Indeed, this report is so good, and I can only address myself as we use this report as a mirror, whereby health is a default function, and we need to borrow much so that we can improve what we have in our county. I like the way the chairman was presenting his report. He was so passionate about what he saw there, and he has invited us for us to go there. But I want to say that we need not to visit that place again, because we believe what they have done, it's a good work. I think he could be very wise if he could invited us to visit our PGH so that we can appreciate what is there. Mr. Speaker, sir, I've always been visiting PGH. Even I was there just yesterday, and I had a talk with the medical superintendent. And we have a lot of buildings that are lying idle. One of the buildings that is there, it is the trauma center. I remember back in 2010, when the late President Mwai Kibaki was there, he started that project. And up to date, Mr. Speaker, sir, that project is lying idle. It's like a white elephant. So we need to visit there and be told what happens of that. The architect of that project had a very positive view of what they wanted the PGH to look like. So I want to say that from this report, we've heard that a lot of things, a lot of positive things that is happening in KU. One thing that I have come to pick is the motivation of the workers. I think that is a paramount, whereby when you hear the report saying that the workers are well motivated, it leaves us now to wonder what can we do to our own, because we have our own. And the sentiment that the chairman alluded that the PGH should be turned into a parastatal, I want to differ with that line of thinking, because health is a devolved function, and we need to be proud of what we have and improve what we have. In Swahili they say, mama yako hata akiwa mlemavu ni mama yako. You cannot envy other people's mother just simply because the way you see them. Let us work on what we have. It is paramount upon us, Mr. Chairman, Health, to put more resources, as you've recommended, to our PGH, to make it attractive and all that. In his report, Mr. Speaker, sir, he even alluded that about the tourism. He said about health tourism. Yes, we should take our PGH and make it a regional tourism hub, whereby people should be coming all the way from even Turkana, Kericho, Eldoret, and all that to come to PGH. Currently, Mr. Speaker, sir, what is happening in Nakuru, if you fall sick, you can only be taken to Nairobi or Eldoret because our facilities are not in a good situation, in working situation. If I can mention, we had our war memorial, it's closed. We had the one which was closed near my place it was, previously it used to be called Medihill. The last name was? It was Medihill, but it's not working. So, Mr. Speaker, sir, currently in Nakuru, we only have our PGH and it is overwhelmed. So, I want to appreciate the work has been done by this committee, but let us focus our energy upon improving what we have so that we can be proud as Nakuru County by having a hub whereby people will be visiting this place in matters to do with health facility. I want to say that I am happy for this report, and also to urge, there is a sentiment that is going out there that there is a committee that visited that PGH just the other day about the cashless transaction. In his statement, Mr. Speaker, sir, the chairman said that ours, we focus so much on what we get in matters to do with finances, but we forget about the service delivery. We should marry the two and improve on service delivery when we are looking for the resources that the monetary fund. So I think there are more to be borrowed from this report, and we customize and localize the report so that we can be proud of our county. I want to register that as I support this report. Thank you, Mr. Speaker.
Thank you, the leader of Majority Party, and the last member would be the member for Dodori, and then the chair would respond.
Thank you, Mr. Speaker. May I also take this opportunity to first of all welcome the members back after the short recess. I'm sure you've come back refreshed and are ready to move on with the various businesses of the House, as we heard from the Speaker's communication, with all the very many pending businesses in the House, that also to urge the committees to expedite so that we can be able to be bringing reports and be able also to be acting on the same reports, Mr. Speaker. Of course, this also being a report, you also expect an action to be taken. I take this time to really thank the Health Committee, led by our very able chair, for the visit to Kenyatta University as an institution. Mr. Speaker, as I passionately listened to the report, we saw a system that is working, right from the first perception when you reach the hospital, to the reception, to how the patients are actually being attended, to the various diagnostic procedures that are being done to be able to help the medical practitioners get to know exactly what is the problem, what is ailing the patient, for a proper type of a treatment, Mr. Speaker. we further saw the flow even to the financial part of it, to the management part of it in Kenyatta University, that even how they manage their finances and how they discharge their patients even as they go home. Mr. Speaker, this flow is a clear indication of a system that is working. And I'm sure when they visited on behalf of this assembly, it is a clear indication that they visited so that they can be able to bring back home the good practices that they were able to see for the sake of us being able to implement. The Kenyatta Hospital, in our case here, would actually be able to refer to a PGH, as many of us are actually alluding to that. And Mr. Speaker, there is a lot for the PGH to learn from Kenyatta University. As the chair said, maybe it's wise for us to visit. I'll go further and maybe request that the health department should organize for their staffs to go and visit Kenyatta University so that they can be able to learn and see what is it that Kenyatta University as staff are doing that our staffs are not doing. Because PGH, Mr. Speaker, to speak very frankly, is in actually not a very good state. The way when you enter PGH, because this is a system, there we saw Kenyatta University, just as you enter, the reception, how emergencies are being handled when you have an emergency. You know, you can stay in the reception, in the outpatient department for so many hours before even being attended to. Our medical practitioners in the department sometimes take patients very casually. We've been there occasionally, Mr. Speaker, at night, taking our people from the various wards. And it's only sometimes until when you identify yourself that you start seeing services moving. But when you go there as an ordinary Kenyan, you wonder what happens to the staffs. And this is only a behavior that they do while in their government institution. The very same staffs, when you go to their clinics, you get amazed at the way they receive you, because I think, as the chair alluded, it's actually for financial gain. Or either they are in the PGH, they are not well motivated because they are the same staffs. That when you're in PGH, you behave like a different doctor, and when you are at a private institution, your character all of a sudden changes. You become friendly to the patient. You have a listening ear to this patient. You become more keen, like what they do in the PGH, Mr. Speaker. So I think PGH, especially on the staffing, because I think we have the facilities. What Kenyatta University Hospital has, we may not be so much at par with them as far as our PGH is concerned, but we have the machinery too. We have the buildings. We have the staffs. We have the consultants. But why is it? The question would be, why is it that we are not receiving that service? The Kenyans within Nakuru are not receiving the services. There was even a case, Mr. Speaker, when even one honorable member had an issue, and because of she didn't even identify herself, she stayed in the casualty for a very long time. The doctors and the nurses were just moving here, doing their own things, pole, until almost around 2 a.m. at night, Mr. Speaker. And at some point, when the member got irritated and even started looking for some bit of evidence to at least be able to discuss before the House, the staffs were quick to discover and even confiscate her phone, so that the evidences cannot be put across. And still this member did not even identify herself, and it was like a punishment. So she was kept sitting until in the morning, just because she was seen with the phone and all that. So the same hospital that she went to seek for treatment became like a small prison within the hospital. It's not fair. I would wish that from this report that we have received, we have seen a working system, that we can be able to take a bit of our staffs so that they can be able to emulate and make our provincial General Hospital operate in a way that is going to handle Kenyans in Nakuru with dignity and will be able to be giving the best to any patient, regardless of the status, because a disease does not know whether you are honorable, whether you are a layman, whether you have gone to school, whether you are not schooled. A disease, when someone is sick, does not know those barriers. Mr. Speaker, every life is precious. And to me, these shelves, it should actually be implemented in such a way that we are going to encourage the policymakers within the Department of Health to go and borrow leaf. You've realized that our hospitals within Nakuru now are limited. We don't have a lot of these hospitals. And our lifeline is the same Provincial General Hospital, which has the capability of performing far much more than even what Kenyatta University Hospital can be able to do, Mr. Speaker. As I support this report, I am thanking the committee for the work that is well done. This should be a wake-up call that we have now seen as honorable members. We have done our roles. Is now upon the PGH also, and the other small government hospitals, the level 4s that we are having, the level 3s or the level 2s that we are having, that they should take up the matter. And some of these are just personal characters, because the doctors and the medical practitioners all go to the same school. They are trained at the same time. They pass through the same periods of training. But we just don't know what happens, that when you're working for the government institution, and hospital especially, your character is totally different from what is seen when you are in a private hospital. So I support this report, Mr. Speaker, with the recommendation that some of our staffs should be taken. It's not even as more now, because we have seen. But let's take this staff so they can see how a normal functioning system is done. And we concentrate on the work now, because as one of our honorable members said, we are always keen at the end product, and more so in terms of what do we get from PGH in terms of money. But we don't see also the end results of what comes out of a PGH when you enter there when you are sick, and how do you come out. So that how much more can you be able to recommend somebody else to be treated and pass through the systems, right from the casualty, maybe to the diagnostics parts, the laboratories, the X-ray rooms, the wards, the discharge areas, until when you are discharged and you are able to come out now healthy and better. So, Mr. Speaker, I wish to support this report with that recommendation that let our staffs be taken for a benchmarking so that they can offer better services to the Nakuru people. Thank you, Mr. Speaker.
Thank you, the Leader of Majority Party. The member for Dodori. And the last member for Barut, and then the chair will respond. And that will be the order, so that we are able to attend to other activities of committees.
Thank you, Mr. Speaker. I like to support the report on health at KU, and also recommend the Committee for Health for visiting such a facility and can bring out such a report and recommendation so that you can implement within our county. Mr. Speaker, it is not just the state of art of that facility, but also the services, the staffing, and the attention given to the patient at that facility. It is recommending, and I just think we need to go by that trend within our county, but there's much more within our county to ask ourselves as leaders, and also as members of this county assembly. Because, Mr. Speaker, if you try to figure the correlation between the services offered at KU and the services offered at our hospitals, there are two different things. Let's take an example like our PGH. The intensive care unit, we just have only 9 beds currently at our PGH, which is serving a very big population within our county. At KU, I have seen through this figure, they have 24 beds. That is not in comparison with what we have here. On high HDU, high dependency units, there are 50 beds. Within our county, we only have 20 beds. So in terms of even the structural and equipping ourselves, we need to have good equipment and good facilities so that we can try to compare the two and give services to our people. We say a healthy nation is a wealthy nation. So health is not something to give a chance, and we need to do that within our county and even in our sub-county hospitals, even in our health centers. Mr. Speaker, like in our health centers, we visit some nurses who complain. Per day, they are attending about 50 to 100 patients. We don't expect those nurses to give good services to the said patients. If you look at the HDU in Kenyatta University, in ICU, the ratio of patient to doctors is 1:1. The ratio of HDU of patient to doctors is 1:2. That means the attendance, the care, is of high level compared to what we have within our facilities. I like the last and not the least, I like to recommend our Chair for Health for the zeal he has presented that information of this report and the passionate. And bearing in mind, Mr. Speaker, at our national level, we have a vacant of CS. I recommend our Chair for that post. Thank you, Mr. Speaker.
Thank you, Mr. Speaker, for this opportunity. I rise to thank Committee on Health, chaired by Mheshimiwa Njuguna, for the good work that they are doing. Mr. Speaker, in fact, Honorable Njuguna has done a lot of work. He's overworking in that committee, Mr. Speaker, because we have seen a good number of reports being tabled before this House, but the issue is implementation. If those reports, Mr. Speaker, are being implemented, I think our health facilities should be on other stage, Mr. Speaker. Mr. Speaker, I'm not going to concentrate so much on this big hospital like PGH. I would like to go down to our dispensaries, where problems started, Mr. Speaker. We have some dispensaries, especially in my ward. I have like 4 dispensaries, but the issue or the main problem there is staffing. You find a dispensary, Mr. Speaker, having only one doctor, a CEO, clinical officer, operating that facility, a big facility, without other staff. So I was asking Mr. Speaker, if it is possible, if we could have at least 2, as a clinical officer and a nurse in those facilities, so that when a doctor is being asked to maybe to take returns or some other reports to the department, the dispensary can also continue to serve patients. Like yesterday, Mr. Speaker, I visited one of my dispensary, Mwareki dispensary, and I found like 20 patients lining up to see a doctor, but the doctor was not present because he was asked to go and to take some reports to the department. So I'm asking if it is possible at least to have 2 doctors in every dispensary. Finally, Mr. Speaker, we have some dispensaries, especially in my ward, Brigade Dispensary, whereby it was built like 2 years ago and it is well equipped, but we're lacking staffing. So we are requesting if it is possible at least to have a nurse and a clinical officer and that facility to be opened so that can help my people. So thank you, Mr. Speaker, for that opportunity. Thank you.
Thank you, the member for Barut. The Honorable Chair, and there are good prayers that have been made by the Honorable member for Dodori. We wish you well.
Thank you, Mr. Speaker. Mr. Speaker, I appreciate the comments that have been made by members. But, Mr. Speaker, allow me to respond to Honorable Kanyeri. You have said that I need to be wise, or I should have wisdom. Mr. Speaker, I want to tell him I am sagacious, Mr. Speaker. And I want to tell him, Mr. Speaker, those who do not move, they think out of their compound or their homestead, they think it's only their mother who knows how to cook. And they think that the delicacy from their mother is the best of the best. But, Mr. Speaker, when they move away, they go and understand new things. Mr. Speaker, as I said, this facility is only of its own kind in sub-Saharan Africa, not in Kenya. Therefore, Mr. Speaker, that's why I'm advocating that we really need to go there, Mr. Speaker. And how I wish, Mr. Speaker, you rule on this, Mr. Speaker, first of all, for the oversighting agency. Because I believe we are on top of the executive so that we can give them the election. How I wish these members can agree. At least we dedicate 2 days. Because what we realize as the committee is that for us to have enough time, it's 2 days. Equally for the executive members. How I wish that the top management of the PGH and also the executive can join us into that training. So that when we'll be holding them to task in the next 6 months, there will be no escape route, Mr. Speaker. That's why I'm requesting, Mr. Speaker, how I wish that Kanyeri will agree with me, that we proceed there and be given some information that are critical for us so that when even we'll be making decisions, as far as the budgeting is concerned, as far as our human resource policies are concerned, we'll be having an informed background and we'll be having some baseline, Mr. Speaker, to rely on or to actually invoke so that, Mr. Speaker, we can have a proper way of doing things. Mr. Speaker, secondly, these facilities that we are talking about, they are parastatals of the national government. And that's why, Mr. Speaker, there are benefits that comes with a standalone facilities. We are not saying that we want to dissociate ourselves from the executive. They will still be under the executive, the Department of Health, but they'll be having their board that are actually independent to some extent. They are not dependent to the, there is a difference between being dependent and independent. We have that syndrome of our facility, PGH here, depending a lot with the executive under the elections that they are getting from the executive. If, Mr. Speaker, they can have a way that they are managing themselves independently, like we have Naruaskos and the rest, which are still part of the Nakuru County government bodies, how I wish that this facility of ours, like Kisii, Mr. Speaker, Kisii Referral Teaching and Referral Hospital is a parastatal of county. Mr. Speaker, they are attracting a lot of grants. Currently, we don't receive grants. But if we can be a parastatal, they are going to attract grants, and they are going actually to compete with other facilities regionally of its status, Mr. Speaker. And by so doing, Mr. Speaker, I believe we are going to go into the right direction. I understand that Kisumu, they are having their referral and teaching facility that they want to give to the national government. But ours, we want to retain it, but still have that status of a parastatal so that, Mr. Speaker, we can continue observing and also injecting our input as far as the management of that facility is concerned, and they are going even to be ISO-certified, Mr. Speaker. Currently, it's hard to ISO-certify the whole department. But that entity alone can be ISO-certified. And even the kind of the service that they are going to be offered there, Mr. Speaker, are going actually to be checked by many organizations, Mr. Speaker. If an institution is ISO-certified, Mr. Speaker, I tell you, things usually change because of the quality assurance department that they are going to establish so that, Mr. Speaker, you can be able to move forward. Mr. Speaker, in terms of staffing, allow me to say that that facility had a ratio even of 1-to-1 in critical departments. If you go to the neonatal department, you realize each nurse is assigned a single child. If you go to the HDU, as they have said, it's 2:1. If you go to pediatric, it's 1:5. If you come here, Mr. Speaker, it's 1:100 or 200. Therefore, quality of service delivery automatically be compromised. But the way to evade that is to make sure that that facility, because it will not actually a profit-making venture, but they will be operating in a business-like manner, we can open that route whereby they can be able to have that autonomy while making their decisions and also moving forward towards improving the health services in Nakuru County. Mr. Speaker, I beg to request this House to adopt this report so that they can be passed to the executive, so that first of all, they can take their staffs there, so that they can be able to see whatever is happening in that facility. And I believe if these members, Mr. Speaker, in the first whole house that will be headed to Nairobi, they will agree. We go there, Mr. Speaker, I will have rested my case, and even perception of the members will have changed, and even the way we'll be tackling the issues of the executive will have changed, because I tell you, that is not Africa, Mr. Speaker. Probably we'll be competing with the UK, even in terms of making laws pertaining health and other places, Mr. Speaker, because that's a new world that I believe, rather than even going for the abroad, for the foreign trips, we can domicile ourselves there, and things are going to change, and we're going to have a new thing and approach towards our health services. Mr. Speaker, I beg to request the House to pass this report so that at least, Mr. Speaker, we can operationalize whatever recommendation we put here. Thank you.
Honorable members, I'm going to put it to question. And the motion is that this House adopts the report on Health Services Committee on the visit to Kenyatta National and Teaching Referral Hospital held on 30th, that is from 30th to 3rd October 2023, which was laid on the table of the House on Tuesday, 16th April 2024. As many who are of that opinion say aye. As many who are of contrary opinion say nay. The ayes have it. Next order.
Mr. Speaker, those are the orders of the sitting.
Honorable members, this House is adjourned to 2:30 p.m. this afternoon.